Good afternoon and welcome to the Department of Behavioral Health update. Today is June 17th and we'll jump right in. June is still Pride Month and we've had a number of activities coming up next week. On June 25th, we have Improving Care Through Understanding the Intersectionalities of LGBTQ plus persons served, and that's from 12 to 1:30. That's a Facebook and a YouTube live presentation. I also wanted to acknowledge and applaud one of our own. Jeffrey Robinson was honored at the recent Pride flag raising at City Hall as one of the recipients of the inaugural Harvey Milk Award. And Harvey Milk was a San Francisco board supervisor who in 1978 was murdered, and he was an openly gay man who had really championed the cause of the LGBTQ plus community. And so this award is named after him, and our own Jeffrey Robinson is one of the first recipients, well deserved. And another recipient was also one of our own Zoyer Zindel, who unfortunately we lost this last December. And I'm using this picture of Zoyer because in it he says, "I want to make history, and I believe in the grand things that I want to live life with no regrets." And so it's really poignant that Zoyer also received this award. The other thing we're celebrating is Juneteenth. That will be happening on Saturday. And today, of all days, President Biden has made Juneteenth a national holiday. So some recognition for the end of slavery in the United States. It actually took a few years after Abraham Lincoln signed the Emancipation Proclamation for slavery to fully end. And so Juneteenth is a celebration of that. And we'll have that celebration on Saturday. All right, on to COVID. COVID marches on. Even though we're starting to get back to normal, COVID will continue. And so across the world, we have over 177 million cases of COVID and just under 4 million deaths. We're now up to almost 2.5 billion doses of vaccines given. And if you look over on the right-hand side and you look at those graphs really represent the surges across the world. And oftentimes when you have declines in places like the United States combined with the surge we saw in India, what you'll see on a graph like this is a little bit of flattening. It won't necessarily show where we have surges. So I'm going to show you India in a minute. In the United States, we have over 33.5 million cases of COVID, and this last week we hit the milestone of over 600,000 deaths at 600,833 deaths. 314,501,000 plus doses of vaccine have been administered in the United States. And if you look at the graph on the right-hand side, you see that we've really declined in COVID cases. I'll give you a little more information about that in a minute. And then I wanted to show you India as well, now has 29.7 million cases of COVID, approaching what we've experienced in the United States. By all accounts, that number is grossly underrepresented in terms of the number of cases of COVID, perhaps by a magnitude of 2 to 10, we're not really sure, and they've had 381,903 deaths. Again, likely underreported. But they are on the decline by all accounts in terms of cases, so that's a positive. And the Delta variant that I'll talk about in a minute came out of India. And as we've talked about, when we have areas with large, dense populations like India, particularly urban parts of India, and you have a surge, the likelihood that variants will emerge is a certainty, essentially. And so the Delta variant is what has emerged out of India, and we'll talk about that in a minute. In California, we're just under 3.7 million cases and just over 62,560 deaths. We have administered almost 40,000 or 40 million, almost 100,000 doses of vaccine. We did have a slight uptick in positivity from 0.8 to 0.9, not a huge increase, but something that we'll want to watch. In Fresno, we're now up to 102,842 cases. That number, the incremental increase is significantly less than what we had experienced previously. So if you look at the graph on the left-hand side, you really see it dwindling off. And same with deaths, which are at 1,722. Just a brief reminder that at the beginning of this calendar year of 2021, we had just over 700 deaths. So we've had almost 1,000 deaths during 2022. So to get down to where we're having just a few deaths a week is really significant, and a sign that, at least for now in Fresno, we've learned to live with COVID, if you will. In terms of hospitalizations, as of yesterday, we had 44 individuals hospitalized, only 6 in the ICU due to COVID, with 27 beds available. So we had ticked up a little bit last week, and we're back down again this week, which is definitely a good sign. The tier is gone, but there was one parting graph that they sent us, or was available on the website. And so on this, you can see that we got down to just one teeny tiny county in the red as the tier system went away. So definitely, most of us in the orange or the yellow tier, again, representing significant reduction in the presence of COVID throughout our communities and our state. In terms of vaccinations, we're now over 850,000 doses of vaccine given in Fresno County. That represents, I have to look really closely, about 52.7% of people eligible for a vaccine have gotten at least one dose, and just under 50%, I think around 47.7 or so, or 48, of all of our population has gotten at least one dose. There's 365,982 individuals who are fully vaccinated and 80,502 who've been partially vaccinated. In terms of those who are over 65, we're creeping up just by a little bit every week. 83.9% have gotten one dose of vaccine. Again, that's our very vulnerable population over 65, so we will continue to work diligently, chipping away at that to make the vaccine available to those who are willing to get it. So in terms of what's happening in Fresno County, as I mentioned, cases have continued to trend down, deaths are down, hospitalizations are trending down again, and vaccinations have significantly slowed. And then nationally, we do continue to see mostly downward trends nationwide. It was announced that the U.S. is going to invest more than $3 billion in COVID antiviral development. What is an antiviral? Well, basically, it's a treatment for a virus. So I don't know about you, but sometimes people will get sick with a cold or the flu or what have you, and you go to the doctor hoping you can get antibiotics. Well, only if it's a bacterial infection will you get antibiotics, because antibiotics only treat bacterial infections. They don't treat viruses. There's very few things that treat viruses. In the last number of years, one antiviral treatment for flu came out called Tamiflu. You've probably heard of Tamiflu. So Tamiflu is an antiviral for the influenza virus, and so they're looking to develop an antiviral for the coronavirus. And the reason that would be important is both for people who are unvaccinated as well as people who acquire COVID after vaccination, particularly with variants coming down the pipe, which I'll talk about in a minute. It would be one more tool in our arsenal to be able to help people recover from COVID or not have significant hospitalizations or severity of COVID, and maybe even prevent deaths. And so the goal is to have a medicine that could be taken at home when the early onset of symptoms occurred with COVID, and then have that available to the public by the end of this year. I will optimistically say, with how quickly we were able to develop vaccines, that I'm hopeful that this will happen, that this antiviral will be developed, and that, again, would be one more tool in our toolbox. I wanted to share this with you. On the left-hand side, it's basically average number of cases of COVID by state. So you can see similar tier system if you think about it to California, where the darker color represents the most concentration, highest concentrations of COVID. So just some really, in the central part of the United States, we're still seeing some concentration of COVID, and then as you go out, less and less COVID. And then on the right-hand side is average number of new cases per day with the darker, the gray colors they haven't reported, so I don't want to misrepresent, they don't have data, but the darker blue numbers showing new cases. So very, very closely paralleling what you see on the left-hand side. But definitely showing a decline from prior. This is on the Mayo Clinic website. Every once in a while I find a new source of information, and this one's real interesting. If you do go to the Mayo Clinic website and look at this, you can actually play a little video, and it shows you how this progressed over the last 60 days, and it will also show you a projection into the future. So I didn't want to ask Brian to show the video, but I thought I would mention that to you because it's kind of interesting as a science nerd. Okay, so what about the Delta variant? Why do we care about the Delta variant? Didn't we offer vaccines? Aren't we getting out of the mask wearing? Aren't we coming back to on-site work? What do we care about this stupid variant? Well, the Delta variant, and if you'll recall, I think from last week, we've changed how we're naming the variants. We're using Greek letters, and Delta is the one represented by the one that developed in India, as I mentioned earlier. As viruses mutate, and again, remember that when a virus enters a human body, the capacity for mutation is there. So the more spread you have in a community, the more capacity there is for that virus to mutate. And as those mutations occur, a virus really doesn't exist except in its ability to procreate. Okay, so to multiply, and it only multiplies when it's in a human or animal host. And so just like human beings have evolved over time, it's trying to survive. And so it develops these mutations over time. Sometimes the mutations have no implications. Sometimes they might make you sicker. Sometimes they might not make you sicker. And so this Delta variant is becoming the dominant variant. It is dominant, it's now in 80 countries across the world. It is dominant in the United Kingdom. In the last week, it went from 6% of the cases in US to 10, so it is expected to become dominant in the United States. And that this has happened throughout the pandemic where different variants come through and a surge happens and one particular variant becomes the dominant variant, and the Delta variant is becoming the dominant variant again. And even the Delta variant will continue to mutate. And so just letting you know that. It has been elevated from a variant of interest to a variant of concern. It is believed to be more transmissible. They believe it's 60% more transmissible than the prior Alpha variant that we had in the last surge. It appears to be at least slightly more deadly. They're still gathering data, but they think when it is the dominant variant, people are dying at a higher rate, and they are seeing some breakthrough infections. Largely, they believe that the vaccines are still offering protection against the Delta variant, but that doesn't mean you won't get the Delta variant COVID if you're vaccinated. They are seeing some breakthrough infections with the Delta variant. There's possibly more severe symptoms than other variants, and possibly slightly different prevalence of symptoms. So what they think right now is some of the symptoms are just kind of more like the common cold, maybe not so much of the loss of taste and smell, that type of thing. Not necessarily new symptoms, but the constellation of common symptoms have narrowed a little bit, possibly with this variant. Again, this will likely become the dominant strain in the United States. We're on path to do that. It will be most risky for unvaccinated individuals. while people who are vaccinated could still get it, it's much more risky for someone who's unvaccinated to get this variant than any prior variant of COVID that we've had. I feel it's my duty to tell you that, and I honor and respect those of you who've chosen not to be vaccinated, but there are variants coming that will be more deadly, that will be more transmissible. And so it's just, if you're going to be informed and make an informed decision, you need to consider that as you consider what your options are. So, with that said, I will say that everything in life carries risks. And there's also consequences to the choices we make, and consequences to what happens in our lives with those choices. And so we're going to do our very best as we return to on-site work to create that safe environment for you and really try and mitigate negative consequences from how we're setting things up, and even considering choices that you individually might have made, particularly as it relates to vaccination. So today, Cal OSHA is meeting again, and for those of you who don't know, I've kind of talked about Cal OSHA, but Cal OSHA governs how employees are treated in the work setting. So the waiting for Cal OSHA guidance is why you still see most workers in retail stores and restaurants and county buildings and businesses wearing masks. Because even though the governor said the tiers are gone, take your masks off if you're vaccinated, Cal OSHA governs what happens in the workspace. And so they had come out with some guidance that widely was ridiculed, and so they pulled that guidance back, said they would meet today, and will come out with new guidance. So our return to on-site work plan continues to be a moving target, and I'm sorry about that. And I hope over this last year, as I've met with you and we've had these presentations, that you've gotten a little higher tolerance for flexibility and an awareness that the enemy of good is perfect, and we're not anywhere near perfect right now in terms of getting this down. What we anticipate, regardless of what Cal OSHA reports, is that likely in our department, we will require masking for every employee, vaccinated or not, as well as the people who visit our department. This will be different than other departments, but we are considered healthcare, and there are different rules around healthcare than there are, for instance, the auditor controller's office. And so it may be that you'll go to a meeting in another department and they might have different rules, and I am very sorry if that creates conflict or dismay for you, but that is what we're dealing with right now, is that it's just a complex situation. And so in our department, to create the safest environment, we're going to require that everyone wear masks for the time being. How long will that last? I have no idea. But what I can tell you is it'll last as long as we feel that that's what's necessary to create a safe environment. The only exception to that will be if you're in a private office. You can have your mask off, vaccinated or unvaccinated, provided that no one else is around you. We'll also maintain that 6-foot distancing, so that's why our plan will have some hybrid work models for people who have shared or cubicle type workspaces. And so right now, the plan is over 140 pages. Oh my gosh, it's so comprehensive. There's so many details that have to be in there for us to meet all of the requirements. And so as we've waited for Cal OSHA guidance and as we've shared it with supervisors and above, we're really going through it page by page to make sure it's accurate, make sure there's no inconsistencies, make sure all the information is updated, and then we're going to create a little cheat sheet for you. We're going to have like a executive summary so that you can look and see, how does this impact me? If you want to go into the plan and understand what an airborne virus is like and what are administrative controls and different things like that, it'll be there and you can look for that. If you want to see whether or not the conference room at Metro, how it can be utilized, and you work at Heritage or Hawk, you can go see that. But we want to give you something that tells you how you're general workday is going to be conducted and how the spaces are going to be utilized, as well as what safeguards have been put in place. And so we're taking our time. I've announced a few different times that we hope to have it ready, and then somebody like Cal OSHA has not given us the information we need, and so we're just taking our time. And so I'm not going to give you a date anymore. I'm just going to tell you when it's ready, and I'll send it out. What I need you to understand, though, is that it's a living, breathing document. It's a document that will change over time. And so if you see the document and you say, oh, I see something here that doesn't make sense, or this is in conflict with what's said on this page, bring it to our attention. We'll get it fixed. It's not going to be perfect. We'll make mistakes. There'll be things in there that new information has come out about and we haven't updated or what have you. We're going to be okay with that. We're going to have flexibility. We're going to have grace for one another, and we're just going to fix it. And we'll go from there. We'll hope to have that out pretty soon. Once we get it to you, remember there'll be that 2-week period where we'll have the ability for you to get prepared based on what your schedule is going to be. Please, if you have any concerns now, talk to your supervisor about those concerns, and so that we can all be ready. All right, a few questions. I know the draft of the plan probably got out a little bit. That's okay. Just know it's still being worked on. So again, if you saw something in it that didn't make sense, someone brought to my attention something about masks and their effectiveness that was a bit outdated, so that'll get fixed. But the plan will evolve as we move forward. And then what about permanent telework? I just put the laughing emoji because I'm just not going to answer that question anymore right now. Okay, so I'm going to look over here and see if there's questions. Just for those of you who are watching live, if you've texted Tina, my assistant, she's on vacation and not able to share your questions with me. So if you want to email me at my email address, I will look at my email in a few minutes, or after I'm done with the questions on the YouTube. And so if you had a question you texted Tina, please email me and I'll look at it. All right. Will we be expected to attend meetings in person once we return to work, or can we still attend via Teams? That will be based on the meeting and what its capability is and what its purpose is. I'm going to be honest with you. I think there's some meetings that really need to be in person, but if we're going to require you to be in person, we're going to set up the room so that you've got plenty of distance, people are wearing masks, and we've made it as safe as possible. But we do anticipate for some period of time that when it's not necessary to have an in-person meeting, we'll continue to have Teams meetings, and as much as possible, particularly where we might have staff who have hybrid schedules, where some staff are at work and some staff are working from home, likely those will stay Teams meetings. And so just keep that in mind. But you could be required to attend a meeting if it's felt that that is the most beneficial way to get the work done. All right, I'm going to check my email and see. I don't see anything right now. It's possible I haven't given you enough time to send me an email. We'll wait one more second. I really want to convey that I know this probably feels a little destabilizing for some of you. We've all very much gotten used to these restrictions. We may not like them, we may feel that they're unnecessary, or we may disagree with them, but we have gotten used to them. And I really want to highlight, there is a massive increase in violence right now. I think I said that last week, might have said it the week before. I want to highlight it again. We all need to have grace for one another. I was out this week and someone questioned me still having my mask on. I was in another retail establishment and someone questioned me for standing 6 feet away. Honestly, in both of those settings, I was just doing it because that's what I'd been doing and I wasn't really thinking about it, but it upset people and got them a little disgruntled even. And so there's really heightened tensions. People are on edge. It doesn't take a lot to push them over the edge. And I imagine that might be the case for some of you. So I need everybody to take a really deep breath. And I'm going to do that right now. It will calm you down. We need to all calm down. We should not create emergency and urgency where there is none. We're going to get through this. We're going to sort through the questions. We're going to figure out the discrepancies. We're going to develop a plan that keeps us as safe as we possibly can. We're going to get through this. But we got to treat each other with respect. We have to treat each other with dignity. We have to calm down. And whether you're vaccinated or unvaccinated, doesn't matter. We still deserve respect. We still deserve dignity. We still have a right to our opinions. This plan that we're putting together needs your input. We'll rely on your input. We'll modify as we go forward. But it's going to be a good plan, and it's going to be a plan that's going to work as best as it possibly can. And so take a deep breath. Every time you find yourself getting a little irritated, every time you find yourself feeling confused, every time you're sad, every time that you just don't know what to do, take a deep breath. Think about what you can control and what you can't control. Ask a question. Give us a chance to answer and support you. And know that we are going to get through this. Okay, one more question came up. A question came up for our program, what the plan would be for workers with children and issues of childcare until their school officially starts. Well, just like it was before the pandemic, childcares are reopening, and the expectation would be that you would make arrangements for childcare just like you would have before the pandemic. If you are making those arrangements or attempting to make those arrangements and having issues, you can contact us. We're working with organizations that are working with child care providers, and we can give you resources to help you find a child care provider. But those are just things we're all going to have to be working through, and we're all going to have to be supporting one another to get through. But it is an expectation that you will make similar arrangements as you made prior to the pandemic. All right, let me check my email one more time. Here we go. One of them was the question that already came up there. Okay, someone said that janitorial came through their building and took down signs for social distance. We can put those signs back up. That was building 319. I think part of this is where we have staff that are provided to us through other departments in the county. And every department, based on their categorization by Cal OSHA, might carry things out differently. Social services, not wearing masks, not requiring people coming into their building to wear masks. That doesn't mean that's how we're going to do it, but janitorial and security are provided by another department. And so they may be operating under the assumption of what their department's doing. And so when those types of things happen, we're going to stay calm, we're going to bring it up to DeJuan, and we're going to fix that problem. So thank you for bringing that to my attention, and we will make sure that we get those signs put back up. At this point, we probably all will do the social distancing without even paying attention, because that's what we've been doing so long. Okay, can we telework permanently? That's just a jokester. There was a laughing emoji, so I appreciate that. Thank you. All right, there isn't any other questions on here and none on my email. If you come up with questions after this live event or you're watching the recording and you have a question, as usual, please email myself and Tina Young, and we'll be happy to either reply via email or at our next update. I said a couple weeks ago that we're kind of going to be looking at how long we keep these updates going. And as we get through this process of returning to on-site work, my intention is to keep these weekly updates at least through the end of July, if not into the fall, and we'll just play it by ear. But we'll do it as long as we need to, and after they stop being weekly, they'll likely go to every other week, and certainly no less than every month. And so stay tuned, and we'll keep communicating with you. Stay safe, take a deep breath, calm down. We're going to get through this. Have a good weekend.